everyone, welcome back. My name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. And this week we're going to be focusing on the last part of that, being a mom. So almost 6 months ago, we had our second little one. Our daughter, I am a girl mom, her name's Miriam, and we actually had her on June 26th, and I've had a lot of questions about how it happened, what our birth story was. I know you guys are really interested in the details, and it's just been a crazy whirlwind. Getting around to it now, so if you're interested, make sure you tune in. So some of you have probably kept up with a few of the videos that I've done in the past when I was pregnant, namely videos about testing positive for COVID-19 during pregnancy, doing some Q&As during the pregnancy as well, to answer any other questions you've had. I've always shared lots of details on my Instagram as well. There's even a pregnancy highlight there, but just generally this pregnancy did feel a little different. In fact, it was a little bit harder, and I had my oldest when I was a resident, so I didn't think it could get harder. But I was wrong. In terms of this pregnancy, I definitely felt heavier very frequently. And heavier meaning a lot more pressure down below and feeling like maybe this baby did drop. But I never really was sure if that was actually a thing. With my oldest, I actually had to get induced. So I'm not really sure how it would have felt for me if labor had actually progressed and the baby had dropped or any of those other signs. I did see a pelvic physical therapist throughout the almost majority of the pregnancy. I think it was from the second trimester onward. And towards the end, she was always telling me that she had an inkling that I was going to go into labor soon. Again, this is baby number 2. I can't really say that I had a delivery of fast labors or anything since my oldest was induced. So one thing she had kind of told me was if you were interested in trying to speed up or have things sort of move along down there and get baby in the right position, she encouraged me to do something called curb walking. So I really didn't quite understand what that was. She demoed it for me, and really that's the only way for me to explain what it is. So I encourage you to watch a YouTube video on curb walking if you are curious about that. But she encouraged me to try that out. I tried it out. I kind of wasn't a big fan of it because I already was having a lot of just pressure down there and back pain, sciatic pain. So walking on an uneven surface just made it feel much worse. So I was not a big fan of it the first time I tried it out. Fast forward to when I was about 39 weeks, one Friday, June 25th, I was, again, just so uncomfortable because it was the dead heat of the summer, and I was outside playing chalk with my toddler. And anybody who's a mom to multiples, then you know that there is no rest when you have another one. If you're feeling tired, I'm sorry, you have another kid to take care of. So I'm outside playing chalk in the most uncomfortable positions, trying to color on the floor and stay engaged and be a good mom. And I remember my husband came home in the afternoon, and we all decided to go for a family walk. I could not keep up because I was slow and waddling. So as my husband and my toddler are, walking at a normal pace, and I'm lagging behind like a geriatric citizen, I thought, let me give this curb walking thing another try. Why not? I already feel pretty bad. Why don't I just try it again? So I did. I tried curb walking, and I tried doing, one left foot elevated on the curb, walking for maybe 5 minutes. Again, it wasn't great, so I stopped for a while and then tried again with my right foot then elevated on the curb and walking. And I remember my husband was like, could you stop? Could you stop? I'm not really into us trying to speed up labor. Just stop. And I was like, I want this baby to come out. Whatever. I'm going to try it. And if it doesn't work, I'm back in the same boat. Whatever. So I tried it out, and nothing. We ended up, doing the normal thing that you do, I guess, for Fridays with nothing else to do during a pandemic. We ordered pizza. We ended up putting our toddler down around 7:30, and tried to start watching a new Netflix show. So we started watching Manifest, and I don't know how many of you have seen it, but it seemed kind of appealing. So we started watching that. We watched 1 or 2 episodes, and it wasn't bad. Around 9:15, I started having painless contractions. and I kind of kept track of it on my phone without my husband knowing. So on the Bump, which is an app, there is a contraction, I don't think it's a calculator, I think it's a contraction timer maybe, and you could just hit, start contraction, stop contraction, and I would do that, and I was seeing that we were getting close to that 511 that you always hear about from your OBGYN. And for any of you who are not aware of the 511 rule, it's contractions every 5 minutes lasting 1 minute. So each contraction lasts 1 minute, and that happening for an hour. So contractions every 5 minutes, each contraction lasting 1 minute for a full hour. So 511. So 9:15 to 9:45, we're watching the show, and again, they're not really painful. I just feel like this tightening, and again, it's tightening of the uterus. It's like a contraction of the uterus, and the uterus takes up so much room when you're like full-term pregnant that you could feel it. So around 9:45, so it's only 30 minutes in, I'm seeing that this pattern is happening. So I decide to tell my husband, and he kind of like worries, like, wait, what's going on? Wait, what? Wait, what's going on? What's the 511? Wait, what are we talking about here? Are you sure you're not in pain? And I was like, no, I'm not in pain. But we had to start thinking about things that if labor were to progress, we have a toddler upstairs sleeping. Who's going to be the one who stays in the house with her? So we started making some phone calls to my brother-in-laws. Before we even did that, I called my OBGYN on call, and I was waiting. I was told like there would be a call back within 15 minutes. I think actually about 25 minutes passed, and I still hadn't heard back. And so here we are, it's like 10:10. And yep, we're still having contractions every 5 minutes, lasting a minute, and they're still kind of painless. And so it's 10:10. I decided to page the on-call doctor again. It's been 25 minutes, I hadn't heard back. And we decide, let's just go ahead and assume that she's gonna say to come in. Why don't we get things going? And if she says don't, then no big deal. So at this point, again, my husband's a little bit more nervous than I am. I don't know, I wanted to actually go back and keep watching episodes of Manifest, and he was like, no, what the hell's wrong with you? let's start getting ready. So I had paged the doctor, and I'm waiting for a call back, and I'm getting a little frustrated here because I was like, okay, so what if I am in labor? I called her at 9:45, it's now 10:30, I haven't heard back yet. Well, luckily she got back to me by 10:40, and it sort of sounded like, yeah, sounds like it's labor. And my main question for her was, well, I have a toddler, should I be coming in, or should I, because she was okay with me laboring at home. My big deal was I wanted somebody in the house with my other child in case we needed to come in and obviously go to the hospital and for the delivery. So she had recommended, yes, I definitely think it's worth you calling someone to come stay with your toddler. So then we sprung into action. Obviously, we already had our bag semi-packed. I have a video on what we packed in our hospital bag. You can check it out here. But we already had our bag semi-packed. We just had to throw in some last-minute things like phone chargers, toiletries, those kinds of things. We both showered, and we're over here making phone calls, trying to coordinate who's going to come into the house, and which brother-in-law can make it. If my in-laws, were a little bit older, they should be driving this late at night. So we're trying to figure out that whole piece of the puzzle. One of them then did end up arriving close to 11:45 midnight, and that was when we said goodbye to our toddler before we left for the hospital, who you can actually hear screaming right now in this video. But I did get a little emotional, I will say, saying goodbye to her. She was sleeping. She probably had no idea what was going on. We had prepped her a little bit that the baby will come. We didn't know what time this was going to happen, so we had been prepping her that mommy and daddy are going to go to the hospital and the baby is going to come. So I kind of just told her a little bit, and I think she woke up and had a little smile on her face, and she said, okay. She gave me a big hug, and I think I was just like waterworks because, of course, like, it's a little emotional moment. So I was very upset at that time. I saved it for when she couldn't see, but I think I was a little overwhelmed with emotion at that moment. So I had one of my brother-in-laws in the house, and we left. We ended up leaving around midnight and got to the hospital around 12:25, 12:30 a.m. While my husband parked, I went upstairs to labor and delivery and I checked in. But this might have been one of the most memorable moments because the whole thing feels like it was such a blur. But I remember that the contractions were getting a little bit more intense as I was like in the shower getting ready to go, or while we were, packing things into the car. Things felt like they were just a little bit more intense and they weren't just painless anymore. Probably on a scale of 1 to 10, they were like 7. I put a towel down in the seat because I remember reading somewhere that, hey, if your water breaks and you're in the car, you kind of like don't want to clean that up or worry about having to clean that up. So I was like, all right, I don't know what's going to happen. Let me put a towel down. And we get to the hospital. Luckily, water still hasn't broken, but it's a lot more painful for me to, wait for the elevator, take those steps. And as I get to the front desk, they want me to register and all those things. Well, my husband and I are waiting, and a couple comes in. And the guy is like frantic. He's like, my wife's in labor. And the wife comes to, and she's like screaming in pain. And she's like, my contractions are, gosh, I don't know how, I think she was saying 4 minutes apart, and they're very painful. And she's like just bent over screaming. And they were like, well, do you know how far along you are? And they're like, yeah, we're 41 and 6. And I'm like, whoa, she's probably gonna have this baby like soon, like very, very soon. So I'm, hearing her in pain obviously kind of like messes with your psyche a little bit and makes you realize like, okay, this is really happening. But the funniest thing I remember is my husband was just like, wait, what is going on? What is going on? He was so just like unsettled by that encounter. Nonetheless, I remember when it was our turn to be brought back, I think it might have been like close to 1:15 was when the doctor came in and she checked me and everything. And they actually didn't go ahead and put an IV or anything in because they said their plan for birth was, let's keep you here for about an hour and see if things are progressing. And if they're progressing, then we will keep you and go ahead and admit you. So my husband and I made a decision. We said that even if it wasn't progressing, because we have the toddler at home, we'll go ahead and choose to have them augment labor. So just kind of speed things along a little bit. But we said, let's just see what happens. We'll chill here for about an hour or two and see what happens. I, at this point, am hungry. I mean, I ate like 5 slices of pizza for dinner. But I'm like hungry. It's close to 1:30 a.m. and it's been a lot going on. So I asked him, hey, what do you guys have? Obviously the cafeteria is closed. So I remember eating a cheese sandwich, and it was made with American cheese. So, like maybe not the most appetizing cheese in the world, but I scarfed that thing down. I was so hungry. And, husbands have like sympathy labor, I guess, and sympathy hunger. So he was like, I'm hungry too. So I remember my husband and I were both just snacking and eating. I'm feeling the contractions a little bit more. They do have the fetal heart rate monitors on me as well, which is kind of reassuring, right? That you can hear how baby's tolerating labor. Personally for me, as these contractions were getting a little bit more painful, I didn't really feel super comfortable sitting in bed. So I actually tried to pace, but with the fetal heart rate monitors, it was a little hard for me to do that. So instead, what I chose to do was actually sit on one of their like birthing balls. It was a little bit more comfortable with my contractions positioning wise. Plus, again, I could keep the fetal heart rate monitors on. And for me, sort of like focusing in on that was a little bit easier. I chose not to get the epidural super early because, again, I wanted to be able to move a little bit through the pain of contractions rather than just, get the epidural, because I felt like this pain was still a little bit manageable and tolerable for me. I talked about that with my OBGYN, and again, because we weren't sure if labor was going to progress, they were fine with it. So, in all classic husband's world, my husband asks around 2 o'clock, maybe 2:30, hey, I think I'm going to take a nap. Is that okay? And I'm like, sure, oh, why not? I'll just stay awake in labor. But yeah, whatever. So I said, yeah, go ahead, that's fine. So I was hanging out, I still remember, and the contractions were getting more and more intense. And actually there was a handlebar on the side of the bed. So I was sitting on the side of the bed, not in the bed, on the birthing ball, and trying to breathe through the contractions, doing all the coping mechanisms that my pelvic PT had talked me through. And I'm so thankful that I went forward with, using her services, but trying to use her breathing mechanisms, all of those things. And they were definitely just getting more and more and more and more intense. And then all of a sudden, I felt like, I don't even know how to describe it, but this bing, like somebody like stuck a pin in me, and this like gush of fluid. And if anybody knows what I'm talking about, yes, my water broke. But it almost feels like you're peeing yourself, but it's a ton of pee. So I actually, because I was so surprised, I immediately stood up and even more fluid gushed. And I was like, oh, okay. And I think I did pee during it too, because I was like, where's all this fluid coming from? What is going on? I think I woke up my husband. I was like, I think my water broke. I think my water broke. And I definitely hit the call bell and called the nurse, and I said, yeah, my water broke. I still remember in the details, I was like, I need to take a shower. I think I peed myself. I need to take a shower. I think I peed myself. I think I peed myself. And the nurse was like, yeah, that's fine. Get in bed. We need to get you an IV. We need to get you an IV. You're not leaving now. You're not leaving. And meanwhile, I'm looking at the floor and I'm like, oh, I made such a mess. I made such a mess. And we have environmental services coming in and cleaning up. And my husband's like, what? Just waking up from his nap. However, this one distinctive thing I remember is the contractions rapidly started getting more intense, and one on top of another. Gone is the 5 minutes apart sort of thing. These were happening every minute to minute and a half apart, if I even got a minute in between, I will say. They were starting to get closer to 8 out of 10, 9 out of 10, much, much, much more intense. And yes, I distinctively remember being like, oh, I had to take a shower, and slowly that faded into the back of my head. There was no way I was going to be able to stand, because that's how much they were hurting. So my water broke around 3:15, and we started working on, I had mentioned that, yes, this is the time I want to get an epidural, because they were getting more and more painful. Luckily, it has to go in order of who comes before, how birth is progressing, C-sections, all of those things. So luckily it seemed like the anesthesiologist was very available at that moment. So once the IV is in, the contractions are coming even more painfully. I'm trying to use my mechanisms, breathing mechanisms, to kind of work through the pain. I had the anesthesiologist come in, and I just remember with the contractions and feeling so much pain, it was really hard for me to sit still. So I broke his sterile field twice, leaning back, just trying to move around, move through the pain. And obviously you're sticking a needle into the spine, the interspinal spaces, so it needs to be a sterile environment. And so me moving around was not ideal, and I felt terrible about it. And luckily the doctor was great. The anesthesiologist was excellent. The nurse was helpful. My husband as well was very helpful. They were so intense that I was squeezing my nurse, and I later told her, I was like, I'm so sorry if you guys hear the baby. I'm so sorry if I hugged you too tight or grabbed your arms too tight, but I was really trying hard not to move. So at this point, when I first got checked around 1:15 a.m., I was about 1 centimeter. When my water broke around 3:15 a.m. and they got me in IV in and got me all settled and everything, and this is before the epidural was in, so the doctor checked me again, or actually I think the nurse checked me again, and holy moly, that check was painful. I was about 5 centimeters. After the epidural, they checked me again, and this was about 3:55. And so like 20-25 minutes or so after, they checked me again, and I was closer to 9 to 10 centimeters. So that's how quickly everything happened. Therefore, that whole 5 to 9 to 10 centimeters dilation happened au naturel. Not exactly my plan. Holy crap, it hurt so bad, it was terrible. There was moments where I felt what we call in medical talk diaphoretic, but like sweaty, clammy from the pain, the body's response to the pain. But at this point, the epidural was in around 3:55 a.m. I remember, and so they checked me and they were like, yep, you're fully dilated. And I'm like, well, finally I feel a little bit of relief because the epidural was there. So they kind of like broke down the bed a little bit and they wanted to do some practice pushes. And then we were ready to go, and baby was born very shortly after. She was actually born around 4:22 in the morning. And luckily, she and I tolerated labor really well. She did have a nuchal, so the cord was around her neck, which isn't terribly uncommon, but still a scary situation for the OBGYN, because you just kind of want to make sure you can, what we call, reduce that nuchal, and make sure that you're able to clear the neck and the airway for the baby as labor is progressing. Thereafter though, I mean, she did really well. She was born 5 pounds 15 ounces. So interestingly enough, on our last ultrasound at 37 weeks, they actually clocked her in at 6 pounds 1 ounce, so she was actually less than that. So that just goes to show you that sometimes ultrasounds do have a little bit of wiggle room, which we always tell our patients. But I'm so grateful that she and I both did really well, that we had somebody around, family around, to step in and take care of our toddler, and that everything went really well, even with the history of being COVID-19 positive during the pregnancy. So I hope this was an exciting episode for you guys. It was definitely a different sort of one, not so educational, but I know you guys like hearing some personal tidbits as well along the way. Hope you all enjoyed reliving this with me as much as I did. Make sure you tune in next week for more content.